Sunny. My mother died of cervical cancer when I was 14. She was 40. She'd just turned 40. I remember the day that my father told me she was going to die. I particularly wanted to be part of this video so that we could discuss loss of a loved one through a vaccine preventable disease. For me, the screening program that we offer today is very important in allowing women to keep a check on their health, with their sexual health, and also allow them to know if there's some changes that have been detected and to have those changes treated. And I don't believe that's what my mother was, she didn't have that opportunity.
Yep, round this way.
I found out I had cancer after the birth of my son. I was waiting for my bleeding to stop, and it didn't. It was really scary the first time we went to the gynecologist, and he told me that it could be cancer, and straight away I knew it was cancer, because I know they try and tell you it nicely, but you know. And we were going home, we were actually driving home. We had left the hospital and driving home, and on our way home I just turned to Michael and said, I'm going to die, am I going to die? And we just had to pull over, and he just gave me a big cuddle.
Got it?
Yeah.
Alrighty. Wait till Mum calls you.
I had to go to Waikato and have radiotherapy for 5.5 weeks. I had radiotherapy Monday to Friday, and on Wednesdays I had chemo for the whole day, and that was just having needles just put in probably around these on my hands and stuff.
There's nothing I could really do for her but just be there and comfort her, and because deep down inside it was hard for me as well, you know, like I didn't really show much emotion because just how I am. I just hold it all in, and it just builds up and builds up. So basically I just was there to help her out and hopefully try and, as much as I could, take all the pain off her that I could.
They say the cancer is unlikely to come back, but I still have to have checkups. I've just recently been for my checkup. Yeah. I'm all good. No, I'm fine. I first went for a smear when I was 17, and that's when I started becoming sexually active. And then I knew you had to go and have smear tests, but I never went for any. I just thought, you know, don't need to, I'm young, I'm fit. I was playing my sports and keeping up. And then when I had my children, I was told by my midwife to go and have a smear, and I still didn't. It became me being lazy. That's all it was. I wasn't shy. I mean, I had 4 kids, and I been in the hospital, and all the doctors have seen anything, so I can't be shy of going to see a nurse. It was just me being lazy. Yeah.
I had just the routine smear, and it came back with SYN3 abnormalities. There are 3 different grades of abnormalities, SYN3 being the most severe before cancerous stage. So that is why the specialist recommended that I have the cone biopsy, because it was only 1 grade below cancer. So I had it done, and 2 weeks later I got the results, and it was fantastic news that they had got all of the abnormal cells, and that it was still only SYN3, it hadn't progressed to cancer. And so I basically thought that was the end of it. I was told that for the next 2 years that I would have to have regular 6 monthly smears just to keep on top of that. The next smear I went for, the specialist phoned me a week after that and said that unfortunately it had come back as SYN3 abnormalities again. And that he was going to need to do another cone biopsy. He said it was very unusual circumstances for that to have happened. And I had Ethan, that's my second son, and he was 3 months old when I went in and had the second cone biopsy. Got the results from that, and unfortunately it was still SYN3 abnormalities, and that they had not been able to remove all of the cells, abnormal cells, and the only option I had was to have a hysterectomy. So when Ethan was 7 months old, I went in and had a hysterectomy done, so at the age of 32. If I hadn't had Ethan when I did, that was going to be the outcome, so he really was a miracle child. We had wanted to have more children, but yeah, there was no choice really. I needed to be around for the 2 children that I had to see them grow up, because the cells were going to turn to cancer. It was just a matter of time.
With HPV, it can change your cells, the cells on the surface of your cervix, and make them abnormal. And if that's left, that can go on to become cervical cancer. So the key is to get those abnormal cells really early, and the way that you know that you have abnormal cells is to have regular smears every 3 years.
If it was not such a good result, what would happen then?
Well, if we take a smear, and this would be your first smear, if we take a smear and there's an abnormality on it, what we do depends on the degree of abnormality. We describe different levels of abnormality of the cells, and if the abnormalities are very mild, we know that there's quite a high chance that they will just clear up by themselves and go away, and all we need to do is be watching carefully and do a smear again, usually within a 6-month period, and check that everything is gone back to normal. If that's not the case, then you'd be referred to a specialist to have further tests done. If the smear comes back showing a higher degree of abnormality, then we would need to refer you to a specialist immediately, and they have a better look at your cervix under a microscope, an instrument called a colposcope, and they may take biopsies if there's any areas of abnormality, and then if that's confirmed that there are any, they can be treated and removed so that there's no risk of progressing to anything more serious.
We know of someone, that, a very close relative, a very dear auntie. It's really sad. She died of cervical cancer, and it was unnecessary, but she is one of those people that never wanted to go to the doctor. She never had any cervical smear test. And by the time she went to the doctor, it was far too late. The cancer had gone through her whole body, and she died.
Yeah, but now it's too late. It's already gone.
It can be very, very easy to treat. If the abnormal cells can be detected earlier, it's a very simple operation, just something that the doctor could just burn off the abnormal cells.
My first abnormal smear was probably at about 22. Them having to, go through the process of going to another doctor to get it dealt to. That was the start of, learning about the fact that, I was going to be one of those ones who possibly started off with the HPV, but then went into being, first stages cervical, and have had to mitigate it most of my life, and have done so, yeah.